Good afternoon, everyone. My name is Matt Dameron, and I serve as the Associate Executive Director here at Cedarfield. And welcome to our second in a series of navigation chats, where we're talking about that safety net that we have here at Cedarfield that we've been discussing for many weeks now. And today we're going to focus on Affirmation Home Health. And I am joined by Jen Rauschenberg, who is the administrator of Affirmation Home Health. And we're just going to be kind of going back and forth. I'll ask her some questions and she'll give us some answers, kind of just explaining overall what home health is, what their company can provide, and we're also going to touch on a couple little rumors out there as well. To try to give you all some clear and concise information about the program and exactly what that is. So again, thank you so much for joining us, and we look forward to sharing even more information. This is just a quick little 30-minute video, and we hope we can give you some good information out of that. So we'll start with Jen. Welcome. We're glad you're here. So why don't we let's just start with you in general. How about, can you just give us a little bit of a background about you and your career and kind of what you've been doing?
Okay. Well, personally, I'm a mother of 3, and my youngest is a special needs adult now. So healthcare's been in my life forever. I have been an occupational therapist for 30 years, and then been in more of the management role of home health for about 15. Home health has been my love. I've done it since I graduated in some capacity. It's what patients are in a happier place when you see them at home. I feel like I make a huge difference because I'm in their environment. I'm not in a structured hospital. So I can't imagine anything else but home health. So this is my second startup. So I have a lot of experience in building the company and building it with the right quality and the right mission behind it.
Oh, that's great. That's great. I think, thanks for sharing that. I think one of the most straightforward questions that we get here quite a bit is, what is home health? So just what is it, just in general? Can you kind of explain that for us?
Sure. Home health is basically receiving your medical care in the home. We focus on you being safe in your environment, being able to maintain living in that environment. So when you go to a doctor's appointment and they look at your meds and they check your vitals, we as a nurse come in and we provide those things. We're like the eyes or the boots on the ground for the doctor. We provide the therapy. We come in the home. We're doing the same thing with strengthening and balance. Occupational therapy, looking at equipment to make it safe for you to get in the shower and get up and move around in your house. We basically bring your doctor's appointments, your therapy appointments to the home, and we're the eyes and ears for that doctor.
That's great.
And we find that it's a happier environment. People are happier when they're home. And if we can make that difference that they don't have to go back to an inpatient rehab or back to the hospital, that's our goal.
Right. I agree with you. I think especially being more comfortable in your home, like you said, just to second that, it's, being in your own environment is so much more pleasant than going to a gym, hospital, or anything like that.
Right.
So thank you for sharing kind of the general idea of home health. So I know this Affirmation company is a new company, and can you just kind of give us an overview of just Affirmation itself, some basic information and kind of how it formed?
Yes. We were formed out of 2 companies that own a lot of retirement communities. It's Pinnacle Living, obviously, and Lifespire Living. They provide a full service services to everybody on there, and basically they have the therapy gym, they have the nursing, they have the clinic, but the one thing they were missing was home health and hospice. When somebody needed those, they either pulled in an outside company, or in hospice they had to go somewhere else. And so one of the pledges they have in these communities is they're here to take care of you to end of life. And so one of the things they did was they thought, let's do a home health company that can bring it all together. Our goal too is to go into hospice eventually, probably within the couple years, but to really have that full circle of care so that people can be home and be safe, but not worrying about having to get out to good appointments. So we are partnered up with the campuses to be able to provide the home health on the campuses.
And you're going into to all of the different Pinnacle Living and Lifespire communities. Oh,
Yes,
okay. Very nice.
We are.
Very nice. So, explain that just for a second. The partnership between the two organizations. Do they own the company? Do they? What? Explain that to us a little bit here.
We're a freestanding owned company. They provided a basis for us to base our company off of.
Okay.
We wanted to model the same mission and vision that they have on their campuses. We're a not-for-profit company, so our goal is to provide the quality under the same concepts that the campuses are built on.
Okay.
So, but we are freestanding. They will provide us with information and anything we need to help us on the campuses.
Okay, perfect.
Nice resource.
Yeah, definitely. So, not only with Affirmation, but home health in general, what type of services do you provide? Like specific services do you provide for the residents?
Home health is supposedly an intermittent care. There is home care and there's home health. On the home care side is the private duty where people stay with them. On our side, the skilled side, we provide a skilled nurse who can come in and help with, like I said, checking vitals, doing a full body assessment, helping with meds, new disease teaching. Then we have therapy. We have physical therapy, occupational therapy, and speech therapy. And then we also have a medical social worker who can assist with certain things like community resources, wills, advanced directives, grief counseling if you've lost a partner or had a life change. Sometimes we assist with the social worker in what's the new term is transitional trauma, to help you when you have to give up a home and move into a community like this and downsize. That's a huge life change.
Great.
So we're there to provide that support also.
Okay, very nice. So you described that this is a pretty new company, and obviously there's other home health companies out there. What do you think, as the administrator of Affirmation Home Health, what do you think sets you apart from the other home health companies that are out there?
Well, part of it is the goal of being a not-for-profit company. We are more at the quality. I think healthcare has become, in general, a very financial-driven practice. I think even with the doctor's offices, and I'm sure with other home health agencies, you see it's a push for numbers. How many patients can you see, and how fast can you see them? How many can we book? Our goal is the quality, and to really be that person for our home health clients. So I think what sets us apart is most of our employees have been in home health for many years. Most of them have come to Affirmation because of our mission of providing quality care and aging in place. So I can honestly say, from being at other agencies, we are going to be providing a higher quality and a much intense program that you feel like you're getting what you need out of that healthcare.
Oh, that's good. Okay. All right. So, I think this is a common question in the world when any type of service is provided. It doesn't have to be home health. It can be just about anything. The first thing that comes to your mind is, how much is this going to cost me? And so what does home health cost? What's charged to the resident?
In home health, any Medicare product covers it 100%. It is
Okay.
billed under the Medicare A part of Medicare,
Okay.
just like the hospitals are.
Right.
So all the managed Medicares, the Humanas, the Aetna Medicares, they're all covered at 100%. There is no cost to the resident, and it's fully covered. Supplies for wound care is covered. Anything that's needed during that care time. Some of the private insurances, like if somebody kept an Anthem federal policy still
Right.
as they were aging, they require us to get authorization. But in general, they don't cause us any problems with getting us the home care. We just have to justify why we're there.
Gotcha. So, well, I'll come back to that question here in a second. So, what do you see as the benefits to the resident? That's often kind of another very prominent question when we're talking about new services or different services than what we've had in the past. You have the cost question, and then how does this benefit us, which is a very legitimate question. So how do you see this service benefiting the residents?
Well, one thing is we bring a service to your home. So it's not that you have to get prepared to go out anywhere, worry about transportation if you have the endurance to go. The second thing is our focus, especially on the campuses, is to really help you stay in the living situation you want to be in. You hear as we talk, well, this person's become unsafe in the independent living. Our goal is to come in there and say, well, we're going to get them safe. We're going to fix this so you can stay in this level of care. So I think that's the biggest benefit is we're in there looking at the home, we're justifying why we can keep you there, and we're there to make you independent. Our goal is always to get you the best you can be.
Definitely. I think that kind of plays into the safety net kind of portion of things, which I'll talk about here in just a minute. But our ultimate goal is to bring services to the resident to keep them as independent as possible for as long as possible, because that's what we all want. So, you talk about occupational therapy, physical therapy, speech therapy. We have a company that is on site here. That's Health Pro Heritage and kind of based out of the gym right down the hallway from where we are now. What I know that this is another common question. What's the difference? What's the difference between Health Pro Heritage and the services that you all offer at Affirmation?
So part of why we have teamed up with Health Pro in here is that we want to have that circle of care, that continuum of care. Health Pro is outpatient. Their goal is to fine-tune the residents' strength, their balance, to have the machines in the gym to work with them and those things, where our goal is to really come into the home and look at function. Our goal is to get you to outpatient. We want to get you safe. We want to make sure you can get dressed, get bathed, get yourself together and ambulate to the gym safely, and then they're going to take over at that point and really work on fine-tuning your strength so you stay conditioned to be able to do all the things you want to do in the community.
Okay, perfect. So kind of, you and I were talking yesterday, and so in a nutshell, you kind of summed it up pretty darn well yesterday, which is Health Pro Heritage is this, and Affirmation is this. What was that again? Just in a nutshell, Health Pro Heritage concentrates on
the strength and high level balance. They're working fine-tuning muscles. And for us, we're there to look at the function. We're really there to get you safe at home. We do strengthening, we do, exercises, but they're very basic in the environment so that you can start increasing your strength to be able to return to the outpatient.
Right. And I feel like, so kind of based off of what you're saying, I feel like when a resident has some type of change, they go to the hospital for a short stay, or they come to one of our healthcare households for a short stay, something has obviously happened. and they're transitioning back home, is that a good time for them to utilize your services?
Definitely, because you've had a status change. You're weaker, or you may have new medications. And so it's not a long-term thing. We can come in for a couple weeks, settle you in, make sure there's no changes in your function and your ability to access your environment. And then the one thing home health can provide is that nurse who can do education if it's a new diagnosis, or they just sent you home with 3 new meds and you're not even sure when to take them. That's where home health comes in with that kind of education, just to make you comfortable after that disease process to be able to function and know you're safe and can move on with life.
Right, definitely. And do you see that that by doing that, by having that extra service, does it lead to a decrease in people being readmitted to a hospital or readmitted to like a healthcare type?
Absolutely. Absolutely. That is our whole goal, is we're keeping you from being in a hospital, being in a skilled nursing rehab. We want you to be at home, so our goal is always keep you home, keep you safe, and so you don't go back to the hospital.
Okay, perfect. So I talked to Jen about this yesterday and wanted to address just a few little rumors that were out there, and because honestly, with any new service, it doesn't matter what it is. There's always questions and uncertainty and kind of the fear of the unknown, and then we all, myself included, start jumping to conclusions about things, and I feel like that's happened with Affirmation as well, because it's a new concept to us here at Cedarfield. So just to kind of head off some of these rumors as much as we can, I have 3 common ones that come up. Is this our ploy to get rid of Health Pro Heritage?
No, it's actually to complement Health Pro Heritage. Our goal is to be that partnership with them. We are working with them, constantly talking about your progress in the home, how they're doing in home health, to get them ready to go to them. So it's that continuum of care we're trying to establish. But in no way are we getting rid of Health Pro Heritage. They're the ones we want to prepare the resident, not the patient, resident to progress to.
Right. I like how you say that, because we also hear a lot. I won't say specific names on here, but we love so and so, our therapist from Health Pro Heritage, and we love this person, and so we really want them to provide those services for us. But kind of what you're saying is it's if utilized correctly, it's a good handoff.
Yes.
Am I mistaken?
No,
it's
it's not. And that's what I'm saying. The communication between us is a constant communication on the handoff, and we get a history from them because they know you, and then our therapists and nurses can follow in that history and be able to assist.
Right.
So yes, it just provides that second layer of care to be able to maintain your life here.
Oh, that's great. Okay. Well, while we're on that subject, how about this common myth that's out there, or rumor, is this going to replace our clinic and the people that are in our clinic?
Not at all. No, I know everybody loves Ann, and she's wonderful, but Ann is one person, and she can only do so much. So we're going to be that adjunct and partner for her, and be able to come into the homes, help with the things that they're calling, saying, hey, Ann, can you come help with this wound, or I can't figure out this medication. We're going to be the person to report back, and 90% of the time I'm calling her anyway to say, hey, this is what's happening with this resident, and then they follow up with her. So we're that person that can help her, but she's always kept in the loop and knows what's going on. So by no means is the clinic going anywhere. They tend to be our referral source to help Ann through all this.
Gotcha. Yeah, I mean, that's, again, just reiterating what you said. We all love Ann, and we love our clinic people, but they have a lot. It's what, over 400 residents, or close to that. Sorry, in independent living, and that's a lot. So to have more specialists come in and help during those interim times, that's great.
And I mean, it takes, like, if you're, some people have been coming to the clinic for wound care. We're going to do it in your home, but we're going to make sure that we take pictures, the doctors know how it's healing, and you're going to still follow up in the clinic.
So since you mentioned it, what type of communication, when you're providing home health services, what type of communication do you have to the physicians?
So the physicians are the ones that approve our plan of care. They have to see everything we do. So our initial order comes from them. We create a plan of care with the physician, with the family, and with the resident. It's resident's goals. It's not what I want that patient to do. It's what that resident wants for their self. And then we create the plan of care on paper, and it goes to the doctor for review. So everything we do has been approved by your physician that's covering you, whether it's an in-house with Dr. Shearer Cook or an outside physician. They review everything and give us the permission to perform it.
Okay. And like you said, all of that is communicated through the clinic and
through notes, and we send for signature. All our orders have doctor's signatures on them. The plan of care has a doctor's signature. Yes, we have to operate under the physician.
Okay.
And Anne receives updates weekly.
Okay, great. That's great. So I think the third rumor here is which is not true. The third rumor that's not true is a lot of people have questions about the Medicare aspect of things. So you talk about how this is essentially a service through Medicare, and Medicare pays for it. And a lot of residents are kind of used to getting certain services by people without charging Medicare. So there's that kind of common little thread that I hear out there every once in a while about, like, well, now they're charging Medicare, but they didn't used to charge Medicare. Is this business really on the up and up? Is this really legal? Let's put it that way. What do you say to that?
So one thing is, you pay into the Medicare system your whole life. It is your security for, down the road being able to have the coverage you get. We function under Medicare conditions of participation. We cannot step outside of that. So everything we perform in home care and home health is under the guidelines of Medicare.
Okay. They
certify us. So first of all, we're following all their rules. The billing is put through audits and made sure that, nothing, we have certain time limits to be in the home, to make it a viable, billable service. I think in the past, because you guys didn't have home health, a lot of other departments kind of bled over trying to help meet that need.
Right.
So Medicare wasn't billed because it was covered under other services. But I think the whole point here is that we can give a more concentrated care. It is billed under Medicare, but it's done the right way and under their conditions of participation, their rules, and the way the government expects it to be run.
So it kind of sounds like there's quite a few checks and balances in that system, that it's not just you kind of randomly billing Medicare and them handing you a check.
No,
it's it sounds like there's quite a bit more to it.
Oh, and there's audits. They audit our charts, and they will make visits to meet clients and survey us. So yes, there's a lot of checks and balances before anything goes to billing.
Okay, it kind of sounds like what I'm used to is the state survey process. Right. They come in and audit our charts and look at all of our records and make sure that we're doing things the correct way. And it sounds like it's kind of the same thing with you all.
Medicare is our state entity that handles it.
Okay.
So
okay.
yes.
Okay. Great. So I'm glad that you can help us disprove some of those things. That's great. And to you did touch on it, but just to make it clear that we can't just randomly start home health services. We have to have a physician's approval, correct?
Yes.
Okay.
We have to have a physician's approval, and the physician has to have seen the patient to have that discussion of why home health is necessary.
Oh, okay.
So, and usually what we obtain is their documentation saying they saw the patient in the office and here's the problem, and now they give us an order for the home health need.
Gotcha. So there's never a time where
we can't just go find our own referrals.
I keep pressing you on it. So there's never a time that home health services are being performed that the physician doesn't know about it.
No, not at all.
Okay. I've got you. That's good. Okay.
Yes, definitely. Okay. And the one thing too I hadn't mentioned was home health. The one benefit, as much as people love Ann in the clinic, is she's here from 8 to 5, Monday through Friday. We are a 24-hour operation. We're like the hospitals. If you call at midnight with a problem and we're caring for you, we're going to get a nurse on the line. We might even send a nurse out to see you. If it's critical, we may ask you to call 911, but in general, we're that 24-hour doctor-nurse consult when you get up in the middle of the night and there's no one else to call. And nobody wants to go to the ER.
Right.
So if we can solve it over the phone or send one of our clinicians out to help you, no matter what time it is, then we've kept you home and you didn't go to the ER or the hospital.
Oh, that's great.
So that's another feature that's nice. We have 24-hour nurses.
Oh yeah, definitely. That's a tremendous thing. So I'm going to take a little break here from peppering Jen with questions. She's done very well so far. Thank you. And just very, very briefly talk about another common question that we receive, and that is, well, Cedarfield has been here for 25 years now, and we have never had this type of company before that's this integrated with the community. Why do we need it now? And the short answer is, and then I'll give you the long answer, is we're trying to provide that service in-house with people that we have strong relationships with. So home health has actually always been on our campus. We have used them and utilized other companies, but it's very difficult to form that relationship because you have many different companies coming on campuses with people that we don't really have relationships with, not only the residents but the team members either. And you kind of go through some service dips and some unpleasant things. So we kind of view this as an opportunity to have something that is really, yes, it is its own separate company, but have something that's really integrated with our community to really provide the best type of service, that home health service. And like Jen mentioned early on, eventually we'll have home care services, so what we kind of refer to as private duty companions. They'll have that under their umbrella, and then also eventually hospice as well. And again, all of those things have functioned here on our campus for many, many years now. It's just there's a lot of different companies out there, and it's hard to have all those companies really work with our team and have those great relationships. So while you still have freedom of choice, we're not forcing you to use affirmation by any means, but this gives us a good kind of on-site company to use and kind of put everything under one roof.
And I think we pride ourselves in learning what drives your mission, your vision, what makes people move into Cedarfield and what makes them stay, so that we can be part of that same family to take care of them and to really meet their needs. Because I've worked for many home health companies, and when you go into a campus like this, you don't know how their campus operates. You're just in there, do that visit and head on out.
Right.
Where our goal is to really learn all the nuances of Cedarfield and be able to meet all those needs and focus on building our philosophy and our treatments just like you would on campus.
Right.
So that's the difference, I think, is we want to be part of the campus, we want to understand it, and we want to meet all the needs where a typical home health visit would come in, do the skill that's needed, and out they go.
Right.
And may not even communicate.
Right. Well, that's true, and we've had that here before, not with you all, but with other companies in the past that, they come on for one resident and then they're kind of gone, and we're trying to track them down to
and figure out what happened,
right,
what they
exactly,
do,
what the
who was
visit
here.
Was. So
yes,
having you all with that close relationship with our team, I think would drastically change that interaction. And I think the kind of longer answer, which I'll just kind of, instead of explaining all of it, kind of point out is that safety net. So we've been talking about that safety net for some time now, and there's actually this long memo that you all have received in the past, and we definitely have some extra copies here in the administration suite, and it really describes all of the different services that can be provided here at Cedarfield, all right here on campus. And one of the reasons that we're doing that and reaching out to all these different communities is because the world we live in right now isn't the life plan or continuing care retirement community of 20 years ago, where it was simply you're in independent living, you're in assisted living, or you're in healthcare. There's so many stages in between, and so many services that we can offer. Like Jen was saying earlier on in this conversation, where we can potentially get you a lot of these services in your home and prevent you from going to a different level of care, or at least for a while, and keep you in independent living, or just the level of care you're in. It could be assisted living
right.
as well. Keep you in that level of care for as long as possible by bringing these services to you. Not just Affirmation, but when you look through this this long list, you have Health Pro Heritage, Dispatch Health, our on-site physicians and dentists, and the wellness clinic, our social workers. It's a huge list of services that we can provide right here at Cedarfield, and not have so many people leaving campus to find those things. So,
and being proactive. I think this whole plan mapped out here with all of the services you provide is being proactive instead of reactive.
Right.
They're failing in this situation, or they're very sick. Now what do we do?
Right.
Well, we're going to protect that.
Right.
I kind of feel like you guys are looking out for, let's anticipate this need,
right.
so it's done.
Yeah, definitely. Well, we're 1 minute over, I think, here. So, my question for Jen, and I've heard this from a few different residents, is so when are you going to come back and talk to us again? When are as far as getting in front of a group of residents and kind of letting them ask their pertinent questions and getting some information from you?
So I had spoke yesterday with Michael, and my request was I have some trifold flyers that I'll be dropping off in the next week or so to put into the residents' boxes. But I really want to have, I don't know if you call them coffee chats, coffee talk, but be able to sit down with small groups and let them ask the questions. Let them, ask us what we do and why we're here, and the same questions we answered today. And if they have specific questions, we can be one-on-one to talk about it.
Right, and you've done that recently at a couple other communities, and that's helped quite a bit.
It has.
Right?
It was the question answer part that really kind of alleviated their fears of why we're here, what we do, and I just feel like that's a better forum.
Yeah, definitely.
So I know the plan in January is we're going to try to set some of those up,
okay,
so that people are comfortable with our services.
Oh, great. I think our residents would appreciate it. I know our team members would appreciate that as well, and learning more about that program. So just want to say thank you all for joining us. We really appreciate it. We hope that this was helpful, and not only gave you some basic information about the program itself, home health and Affirmation, but kind of dispelled at least a few of those rumors that are out there. And thank you so much, Jen, for taking time out of your busy schedule to come and talk to us. And we really appreciate it and look forward to having you in the future and working with Cedarfield.
Thank you.
Thank you very much. Thank you all. Have a good one. And if you have any questions whatsoever, please feel free to reach out to Jen. We can get you her information. Reach out to myself, Matt Dameron, or the administration suite, and we can definitely help answer any more questions. So thank you all very much.